You're welcome back. And the discussion segment today marks National Childhood Tuberculosis Testing Day, and today, joining me to spotlight effort to combat this health challenge with insight is Dr. Chidiebere Rosemary, Program Manager, Tuberculosis, Leprosy and Buruli Ulcer Control Program, Enugu State Ministry of Health, and Dr. Obinna Chukwuebuka, Consultant Paediatrician with ESUT Parklane, Associate Professor and Head of the Department of Paediatrics, College of Medicine, ESUT. You're welcome, Sam. You're welcome, Ma.
Thank you for having us.
All right, so when we talk about tuberculosis, people often think of coughing and pain in the chest. What exactly is tuberculosis, and how does it differentiate from adults and children?
Yeah, thank you, Ma. Tuberculosis is a communicable disease. It's an airborne disease which can be gotten from an infected person to another person as a result of coughing, sneezing, release of this bacteria through aerosols coming out from the infected person to the air. So being infectious, it easily gets spread, and that's why we're here. It spreads on the air, and the person at risk is the person that's in contact with the infected person who is not on treatment. It's a bacterial infection which was discovered by a German physician many years ago, 1882, precisely. The physician, that was a German, Robert Koch. Okay. So it was named after the German physician who discovered the bacteria as a result of staining. He did.
Okay. So how does the tuberculosis in adults differ from the ones in children?
The presentation is similar. It differs in the fact that a child will not tell you, Mommy, I'm losing weight, Mommy, I'm coughing. It's the adults, the parents, the caregiver of that child that will observe all these symptoms in the child and report. So mainly the disease in children is somehow difficult in identifying, and that's why we're here. So many children are being missed out in the society, and we're here to create awareness so that even the parents of these children, the caregivers, we know when a child is being suspected to have any of these symptoms that will warrant taking the child to a health facility for further care. And even among the physicians, some of the physicians miss out diagnosis as a result of not being aware of how this presentation is in children.
All right, so Dr. Obinna, aside persistent coughing, like she said, and losing weight in kids as being symptoms of tuberculosis in children, what are other signs and symptoms of tuberculosis in children?
Okay, thank you very much. Well, just as my colleague has mentioned, apart from the cough and the weight loss, but typically some children will present with night sweats, excessive night sweats, okay, and then the fever, okay, high fever. And apart from that, you may find a child that may have TB just presenting with poor weight gain, or what we call failure to thrive. Okay, and then other constitutional symptoms. The child is not eating well, the child is fatigued, the child has, poor interest. It's not as active and as agile as the child should be. So typically, it's that index of suspicion that should arouse the interest of a caregiver or a healthcare worker, be it at the local level or whatever level, in having that suspicion that this child could have tuberculosis. And particularly in some instances, we may have that issue of exposure. You have an adult who has a long-standing cough. Okay, usually a cough that has lasted more than 2 weeks or more. Okay, and then that should arouse that suspicion. Or an adult that is already diagnosed to have TB, okay, is that high likelihood of now giving that to children around, as well as other adults. So typically we've noticed that an adult with TB is likely or can actually infect 10 to 15 other people with TB. And if we're aware of data, we realize that out of every 5 cases of TB, 1 is more likely to be a child. So TB in children is something that should be brought to the fore. And for the fact that it's a disease that is curable, totally curable if found early, no child should die of TB anywhere in Nigeria.
Talking about tuberculosis being curable, there's a misconception that it's not curable. Besides that misconception, are there other misconceptions about tuberculosis you'd like to clear?
Yeah, there are lots of them. People look at TB as an illness that people should be stigmatized about, and it shouldn't be. There's a lot of stigma about tuberculosis. Tuberculosis is a type of a pneumonia. Just like anybody can have a pneumonia from virus, from fungal organisms, okay, and then from bacteria as well. So the Mycobacterium tuberculosis is also a bacteria, okay? In this case, because of the fact that the way it presents, the slow-growing organism, okay, it runs a long-standing course, okay? And for the fact that, just like every other pneumonia, one can die from it. Now, the medications for TB is different from that of other pneumonias that we know. Okay, so the issue now is, why do we now stigmatize against tuberculosis, which is more or less a form of pneumonia? 80% of TB is affecting the lungs, and that is what we call pulmonary TB. Okay, other 20% can affect other organs, the lymph nodes, the bone, okay, and other tissues of the body. But most of the cases of TB that we have, 80% are from the lungs. Okay, and that's the one, like my colleague mentioned, you can actually spread easily by coughing, sneezing, even when you talk and sing. Someone that has the bacilli that is, that is highly infectious can actually give that out. Okay, it's suspended in the air and one can pick it. So the stigma for TB is unfounded, and it's worrisome why we should stigmatize against that. And because of that, people find it difficult to come out when they have signs and symptoms. They tend to hide. They come up with, God forbid, it's not my portion. Yeah. You have all the telltale signs, the investigations, the treatment is free. You don't have to spend anything. So why should people stigmatize? You didn't do anything bad for you to have TB. You are living your normal life and you have a TB. Anybody can. Even the health worker that is treating people in the hospital can have TB. So the reason, our main worry is, why are people stigmatizing against people that have TB? Why is it that people that have TB don't want to come out free? We have cases of people that are diagnosed, we want them to come and start medications, they disappear. So these are the issues, and we're not worried, we're worried about it. That's why we're here, to create that awareness, to make people to come out freely, get tested. You don't wait until you are found out by a health worker that your symptoms are suspicious of TB. You should volunteer, get tested, and be sure that you don't have. And if you have, you get the treatment free and get cured.
So for the sake of timing, how are you guys commemorating this week? And are there any sensitization programs?
Yes.
Okay, so how's it being gone about?
Yes. The national program, the National TB program, has marked this 1 week, 22nd to 28th, for us to commemorate activities of tuberculosis in children.
So where's the program happening? Is it free?
Everything about tuberculosis is free.
So where is it happening?
The outreaches we are there to search for these cases, to find them, diagnose them, treat them free.
So where is it happening?
So as I'm talking with you now, there are ongoing case finding activities, form of outreaches going on in all the HEAs.
Okay.
It has been a lot of ongoing activities we do in the program. But for this week, we've strengthened the case search. As we're talking here now, there are groups in different LGAs, like Atudi Ungo Community Service School, precisely. A team from the state program is there with Caritas team, having an outreach activity there. Likewise, for other LGAs, the supervisors are there doing the outreaches. That is that of Enugu, that state program has joined the supervisor and other people working there in the AGA to do this activity.
Okay.
So this awareness question we're here is part of the 1 week activity. We have had some jingles. We started playing since Monday, creating awareness for people to know that TB is real. It exists. It affects both children and adults.
All right, Dr. Obinna, is there anything you'd like to add to that?
Yes, I want to add that part of the awareness question is why we're here, really, and education is key. People getting to have the right information, know where they can source information is very important. And so, despite the activities of the week, the health centers are there, health facilities are there. Every single health facility has health workers that can give 1 or 2 information about TB. So people are free to ask questions. Okay, and when you have any suspicion, if the suspicion is there, the cough, the fever, the night sweats, the weight loss, swelling at the back, okay, these are very basic symptoms that may suggest that the child should be taken for assessment. Sample can be taken if the child can cough up sputum. Okay, for smaller children that cannot cough up sputum, we can use their stool sample.
Right.
Okay, then the chest X-ray can be done, and that chest X-ray is free. Currently, we have free mobile chest X-ray machines. We have X-ray machines that have been brought into the state, which will soon be deployed to facilities. Yeah. So you don't have any reason whatsoever why you will not access these facilities and get diagnosed. And then the medications for TB is free. Now, when you don't take those medications, you move from the common one, which is the drug-susceptible TB, to the drug-resistant TB, which requires more higher medications. Okay, and then you're also propelling sharing the bacilli across, infecting more people and causing more problems nationwide. Because TB anywhere is TB everywhere.
Thank you so much for that, sir. And that's the much I have for you on the news today. Do all follow us on our social media platforms at Afia TV Official. I'm June Udinibu. Good afternoon.